What I want to do next is show you how to do a quick surface anatomy and joint-specific testing of the cervical spine. I always like to start with the easiest structures first. So I'm going to start with the occiput, and there's going to be a little divot before the first spinous process. The first spinous process that you feel is going to be C2. So I go from occiput to the divot in between. It's going to be the posterior arch of C1 to C2 spinous process. When we're at the caudal tip of C2, I'm going to push anterior lateral, anterior lateral, anterior lateral until I feel a little speed bump. That speed bump is the facet joint of C2-3. So I'm going to hit C2-3, climb the hill, slide down. Climb the hill, slide down. And I want you to feel the three-dimensional nature of the facet joint. So I'm going from the lamina up to the facet joint. Lamina up to the facet joint. Then when we're on the facet joint, I want you to feel the facet joint that you can't slide up and down without any resistance. You can just easily go up and down. But then I'm going to supinate my finger into the articular pillar in between the facet joints. And so we call this the valley. The facet joint's the hill. The articular pillar is the valley. And I want to be in the articular pillar when I do joint-specific testing. So once I'm here, my hand's upside down. So I want to just spin my hand without rolling anywhere, point my fingers up towards the eye, and then tip the head and take C2-3 and move it over, or C2 and move it over on 3. And I'm going to go down, supinate onto the next facet joint, keep going into the next pillar, and then correct again. So I'm going to show you that on Lita's neck. I start with the occiput, posterior arch of C1, and the first spinous process I feel is C2. I'm going to go to the caudal tip of C2, push anterior lateral, anterior lateral, anterior lateral until I feel a little speed bump. I'm going to go up the hill and down, up, and then when I'm on top of the hill and I go craniocaudal, there's nothing stopping me. But when I supinate in, now I'm in this little groove we call the valley. I know it's not big, it's a little groove more than a valley. But picture a big valley, and that's my articular pillar. So I'm going to be here, upside down. I'm going to spin my hand, point my fingers towards the eye. My thumb kind of rests on the first rib. And then what I want to do is take a little tripod grip, stabilize firmly, and try to side bend the head. If the joint doesn't move, if you can't move the head, it's stiff. Often C2-3 is stiff. So don't try to push through it. Just lock in, test, doesn't go. I'm going to then go from this articular pillar, supinate onto the next facet joint, supinate into the next articular pillar. I'm in that groove, spin again. That's how it should move. So C2-3 was stiff, C3-4 moves just fine. I'm going to go to the next level. On to the next facet. Keep going on to the next pillar. C4-5, 2, 3, 3, 4, 4, 5 moves great. Facet, pillar, C5-6 goes even further. Sometimes you get to C6-7. On Lita we can. And it moves even further. So what we always want to do is start with your osteokinematic motion first. Is there a limitation of range of motion? Then go check the arthrokinematic motion. Is there stiffness at the joint? Then I'm going to mobilize the joint. Once the end feels have changed 2 to 3 times, I'm going to recheck the joint, and when that moves better, I'm going to recheck our osteokinematic motion. Because at that point, the patient's going to have more confidence in you, and you're going to have more confidence in yourself when you made the local change, but also they're able to turn further without pain.